Hi, my name is Dr. Sakina Raj, family physician and associate professor at University of Calgary, Family Medicine Department. I am going to talk under the series MDI is doing for breast awareness campaign. As we all know, October is a month of breast cancer awareness. Thanks to MDI to organize this. I am talking about risk factors for breast cancer. Now, mostly I've referred CDC latest paper published in September 2021. Studies have shown that your risk for breast cancer is due to combination of factors. I've divided these risk factors in two categories. One is modifiable, which you can change, and the other group is you cannot change it. Now, risk factors which you cannot change it is, of course, number one is getting older. We cannot reverse back, unfortunately, our age. But as the breast cancer risk increases, as our age increases, especially after menopause, after age 50, 55. Then genetic mutations. We might have heard about inherited changes or mutations to certain genes called BRCA1 and 2, BRCA1 and 2. Women who have inherited these genetic changes are higher risk for both breast and ovarian cancers. Now, how I know that I have BRCA1 gene changes or not? Usually, those people have strong family history of breast cancers, especially at early age. And then, obviously, here, if I get one or two sisters or mom and daughter having at early age breast cancer, then we do send them to check for BRCA1 and BRCA2 genetic testing. It's referred by your family physician. Third is reproductive history. If you are exposed to hormones longer, that means if your age of menarche or your menses started at early age before 12, or your menopause is late, like after 55, then you are exposed to more hormones in your life and increases your risk. You are at high risk of breast cancer. Then having a dense breast. Then personal history of breast cancer. If you had a one-time breast cancer, chances are that second time you can get it. Or family history of breast cancer, we already talked about. And then any kind of radiotherapy you have taken on your chest for example, Hodgkin's lymphoma or lung cancer or any other reason, then your breast cancer risk increases, especially if at early age. Now, eighth one is women who had taken diethyl stilbestrol, kind of hormone called DES. This was given before 1940s to 1970s to prevent miscarriages. So if you have been exposed to diethyl stilbestrol in past, your chances of breast cancer increases. Now, some of the risk factors which is in your hands, that means you can change it, are called modifiable risk factors. For example, not being physically active. It increases risk of your breast cancer, as for other diseases too. Overweight, obese, especially after menopause, increases your risk. Taking hormone therapy, both estrogen and progesterone, for a long time if you are taking birth control pills, or after menopause you are taking hormone replacement therapies, it may increase risk. Now, also reproductive history. If you have first pregnancy late, after 30, if you are not breastfeeding or never have a full-time pregnancy, it increases your risk of breast cancer. Also smoking, excessive alcohol intake, exposed to chemicals, and also sometimes they say night shift working, which changes your other hormones, may increase your breast cancer risk. Now remember, to have breast cancer risk does not mean that you will have breast cancer. Again, it's just awareness that you should get proper age-appropriate screening and talk to your family doctor if any of the risk factors are there, which I spoke. And quickly I'll finish with who is at high risk for breast cancer. Highest risk are strong family history of breast cancer and inherited changes in your BRCA1 and 2 genes. And how can I reduce risk for breast cancer? I already talked about, but I will repeat, and please, all the women who are listening, do it. Keep healthy weight, exercise regularly, decrease alcohol intake, stop smoking if you are, not to take long-time birth hormones or hormone replacement therapies, breastfeed your children. It helps reducing your risk of breast cancer.